I guess
Closed captions.
yes.
And then
I should probably, I'm gonna stop sharing actually, so I have the actual.
Oh my God, so I'm not showing on speed.
do you want me to log in from there and just assist remotely?
I brought my laptop.
Okay, so you can do that. Okay.
Yeah.
Welcome, everyone. We'll get started in a few minutes.
Everything else is set up, right? I can start sharing. I hate when it's up top. I can never.
Just check this here because I don't see. Hi, how are you?
Good, it's working.
Okay, hi, everybody. It's Bart from HR. I am here with, so for the people that are in the room, I am here with Kim Capuccio, who is our new program assistant. So Kim started a couple of weeks ago, and I think everybody probably knows by now, but in case you didn't know, Johanna De Jesus left us in July. She went to Columbia University in New York. So Allison Hesser, who has been with us as our program assistant since January, has taken Johanna's spot. And Allison, I mean, Johanna had 14 years of experience in benefits. I have 25 or something like that. Allison has done an amazing job in bringing herself up to speed. So I have absolute 100% confidence in her. So we are available for all of you at any time. Phone us, email, stop in, we're here for you. And all three of us will be able to help you. We created a new benefits@stockton.edu email address. So we all get that in addition to Joyce, who's also on the benefits team. She's the lead, she's the lead coordinator. So if you email that benefits email address, one of us will get back to you. So for today, I'm probably not telling you things you don't already know, but I figured some of the other unions had reached out to me and asked me to do a presentation. So I wanted to make sure that I talked to AFT, you all as well, just to kind of reiterate some of the things that you probably already know. On October 3rd, we sent, from the HR email address, we sent you 2 emails regarding open enrollment. So the one is on the screen now, State Health Benefits open enrollment now through October 31st. And there was another one sent the same day regarding tax save flexible spending account open enrollment through October 31st. So every year open enrollment during the month of October, you can make changes. Any changes you make in October will be effective January 1st. If you are happy in your health benefits plan or in your dental plan, you can ignore the health benefits open enrollment. There's nothing you need to do. If you do the flexible spending account, you have to do that every year. It will not roll over into the next year. So if you're doing it in 22 and you want to do that in 23, you have to re-sign up during the month of October. Up to October 31st, they're making no exceptions on that. So if you don't enroll in the FSA by October 31st, then you won't be able to participate in 23. So, reminder too, and I put this in the email for the first time this year because we do run into this problem pretty much every year. So when people have newborns, if it's your first child, some people, because babies don't have teeth yet, some people just add their babies to their medical and don't want to pay for family coverage for dental because their baby's not going to use the dentist. So that means at a future open enrollment, when you figure it's time to schedule your kid for a dentist appointment, you're going to need to add the child to the dental. So I just put the reminder, if your child, no longer a newborn, is starting to sprout some teeth, you may want to use this month to add them to the dental plan. Okay, so the big thing are changes. So you know that, you know, the warnings have been coming because of COVID. Our usage of health benefits over the last couple of years has increased, not only because of COVID itself, but because we were all locked down for so long and we weren't going to the doctors and getting all the things done that we should have normally been getting done. We're now all catching up and going and getting our appointments and tests and things like that. So usage has gone up. So the state has been warning of potential double-digit increases in healthcare costs and healthcare premiums. So my shout out to all of the unions. They did a very, very good job making this could have been a whole lot worse for us. They all did a very good job, and we're looking at a 3% increase. So remember, we are all in the new union negotiated plans. All of the unions, all of the Stockton managers are in the union negotiated plans. We are now paying a percentage of our salary for our benefits. We'll see a 3% increase of what the actual deduction in 2023. So those changes will take place. You'll see it increase in pay 1 of 2023. If you are making any open enrollment changes, the actual change you'll see in pay 2, because we go for changes, we go by the pay periods, and January 1st would be in pay 2s. So that's where you will see, you know, if you switch from New Jersey Direct to Omnia, that change will be in pay 2, because that's where it would fall in the pay periods. Changes for next year. So our copays are going up for specialists. So right now, and the vast majority of us are in the New Jersey Direct plan. Copays are going up. So for specialists, they are currently in 2022, $15 copays. In 2023, our specialists will go up to $30 copays. Okay, so an exception is women. Your OB/GYN is like your second primary care doctor. So you get 2 primary care doctors, your OB/GYN appointments will still be $15 copay. All right, but everything else will be, all other specialists will be a $30 copay. Your vision exam, your eye exams, your ophthalmologist is $30 copay. All right, couple ones I want to kind of give you an extra reminder about, because I don't want you to have shock when you use them. A lot of people use chiropractors frequently. Chiropractors are specialists, so your chiropractor will be a $30 copay now. All right, a concern that has come up is for mental health counseling. So psychiatrist appointments or psychologist appointments, they are specialists. They will now be a $30 copay. So that question has come to me because that's obviously a concern for some people. I reached out to State Health Benefits and told them it was a concern. All right. However, they don't really care what I think or what I say. You know, I would say the unions are all aware of this. So as they're now at the table negotiating for the next contract, they are aware that there is a concern among their members about this $30 copay for counseling. So that's out there, and it's, you know, it'll be discussed at least. The other copay increase is that urgent care appointments, which are now $15 copays, will go to $45 copays for urgent care. All right, they are really pushing us to go to our regular family doctor for things like this, not urgent care. The problem I find is I had a doctor that I would call the office, tell them I'm very sick, and they would say, oh, you're sick, you need to go to urgent care because we can't get you in. But they are trying to have us go to their doctor. So urgent care will be $45.
What about PT?
I believe they are up, I think that's up to 32. I do have here, so.
I have never had a copay for PT or OT before.
Send me an email and I'll follow up on that. So here in this email, you'll see the 2023 plan overview. This will open up the book that the state published for the comparison guides for all the plans. Just make sure they have all of the state plans there. Just make sure you're looking at the page that says union negotiated plans, because that's all of you. Okay, so like I said, New Jersey Direct, the PPO plan is the vast majority of us are in there. There may still be a few people in the Horizon HMO plan. Probably that's because you've had it for years, you've never had an issue with it, so you just kept it. I would suggest if you're still in the Horizon HMO plan, maybe within the next, before the 31st, maybe reach out to me or Allison. Let's talk about the New Jersey Direct plan, the PPO plan, because I honestly think, and I've thought about this a lot over the years that I've been here, I don't see a logical reason to have a PPO plan, or I'm sorry, an HMO plan, if you have an available PPO plan. There's no logical reason to take the HMO over the PPO, especially since you're not saving any money out of your payroll deduction. I think the HMO might cost you even a little more. You have no out-of-network benefits. You have no flexibility. You have to get referrals. So if you still have the HMO because it's been working for you, let's talk anyway, just to give you something to consider. Okay. Then there's the Omnia plan, the tiered plan. So the this type of plan is very popular out in the private sector. The state added it 2 or 3 years ago, and the state is pushing the tiered plan. The state really wants to incentivize us to go into the Omnia plan. The Omnia plan, your deduction, your cost share, meaning your payroll deduction, would be 25% less in the Omnia plan than it would be in the New Jersey Direct plan. All right, because the cost of Omnia is 75% the cost of the PPO. But the plan works a little differently. So, in addition to that, the state, like I said, really wants us to go into the Omnia plan. So they are, again, I think for the 3rd year in a row, offering us an incentive. If we switch out of the PPO into Omnia, they will send us a $1,000 gift card before the end of the year. Now, a couple of things about that. The gift card, I think the way they do it, it's an electronic gift card. They're going to send you an email to cash it in. One thing about that, though, is the $1,000 is taxable. So they will send you an email, and they will send me and Joe Marcello and payroll a list of the people that got the $1,000 incentive, and they send it very late too, because it is the state after all. They send it very late. So in pay 26, the last pay of the year, we're going to have to go in and through payroll take all the taxes on that additional $1,000 in earnings. All right, but they do want us in that plan. So, you know, $1,000 right before the holidays is not necessarily a bad thing. But I do want you to kind of understand how the plan works. All right, because it is going to be cheaper for you out of your paycheck. All right, Omnia it's kind of a hybrid plan between a PPO and an HMO. So PPO is the easiest type of plan, which is New Jersey Direct. It's a nationwide network. You have in-network and out-of-network benefits. All right, again, nationwide network. Any doctor or provider around the country that belongs to that state's Blue Cross PPO network would be considered in-network by Horizon New Jersey Direct. It's really easy. Pretty much 100% coverage in the PPO other than those copays. All right, you always want to make sure diagnostic tests, your doctor suggests you get an MRI or a CT scan, all of that stuff needs to be pre-authorized. Please don't have yourself wheeled into that MRI machine until you know there's a pre-authorization, because you cannot get a retroactive pre-authorization after the test is taken, and that's expensive. All right, but otherwise the PPOs, copays, 100% coverage in network. Out of network, you have a $400 deductible. and then 70% coverage after that. So you're paying the first $400 and then 30% coinsurance. All right. But again, it's a nationwide network. All right. So I know there are people that periodically end up having to go out of network, but there are providers all over the country that are in network. So that's the PPO. That's easy. Horizon Omnia is the tiered plan. All the providers are divided into 2 tiers, tier 1 and tier 2. Between the 2 tiers, you basically have the same network that you have in New Jersey Direct. So it's tier 2 is nationwide coverage. As long as they participate with the Horizon PPO network, they would be in network in tier 2. Problem with tier 2 is you'll have higher costs. Tier 1 is only New Jersey doctors. Tier 1, you have very low copays, and you're covered at 100% really after that, if they're tier 1 providers. Tier 2 providers, your office visit copays are higher, but anything that's not just a simple office visit copay, if it's a tier 2 provider, you have a $1,500 deductible, and then you have 80% coverage. So again, you will only find tier 1 providers inside New Jersey. So if you cross any bridge or through any tunnel to get services, you're always going to be in tier 2. So you know you have the higher office visit copays, and you've got that $1,500 deductible for anything else. So yes, you're getting less money taken out of your paycheck, and yes, you're getting that $1,000. But if you use out-of-state providers, you are going to pay that somewhere. You're going to pay it on the back end. Also, while you'll only find tier 1 providers in New Jersey, it does not mean every New Jersey provider is tier 1. All right. They have tier 1 has about 2/3 of New Jersey providers. So there's still another third out there that are not, or would be tier 2, even in the state. And I'll give you one cautionary tale, which if you've been through orientation recently, my apologies, you've already heard the story. And this has happened to more than one employee has come to us for this. So employee goes in for surgery. They've chosen a tier 1 surgeon. Their surgery is at AtlantiCare across the street. It's a tier 1 hospital. They figure they're covered. But after surgery, they recover, everything's good. They get a bill from their anesthesiologist. The anesthesiologist was tier 2. Now, I don't think you get a choice of anesthesiologists. You get who's ever on shift, on rotation that day. Also, you are the bravest person in the world if on the morning of surgery, when the anesthesiologist comes in and introduces themselves to you, you ask them what insurance tier they're in. I am honored to know you if that is you, all right? So there's always these little things that could potentially happen with Omnia. I'm absolutely not bad mouthing the plan. If you go get a private sector job, this is a popular type of insurance, these tiers. But you do have to do a little more homework with Omnia than you do with New Jersey Direct. You have one question with New Jersey Direct: are you in network or are you out of network? With Omnia, you have to know the tier too. So if you're thinking about the Omnia plan, I would suggest that you get that New Jersey provider directory, you bookmark that page, and you really be careful to check every doctor to see what tier they're in. And we can individually, if you're considering that, we can talk about that. So I know they are pushing this. I've always said to myself, whatever I have to pay to keep, as long as they're offering New Jersey Direct, whatever I have to pay to keep it, I will pay. The one consolation for me for Omnia is that, at least last time I checked, Cooper in Camden is a tier 1 hospital, and their doctors will be tier 1. So they have, MD Anderson Cancer Hospital has a very, very good reputation. So I've always thought, well, if they force me in the Omnia someday, at least I've got Cooper. As far as the medical, that's pretty much the main changes on medical. So the copay increases are obviously a bummer. Keep in mind that we do have the flexible spending account. So the flexible spending account is, if you've never used it, you can put money aside tax-free to pay for unreimbursed medical expenses. Unreimbursed medical expenses are anything that the insurance is not covering. So copays, you know that our vision benefit here at Stockton is nothing to write home about whatsoever. All right, you know, you get this reimbursement maybe once or twice during the contract, but we will reimburse you up to $40 for lenses and up to $35 for an exam. All right, so that benefit is always there. You do that that is paid through payroll, but you know that Horizon does not cover anything for glasses or contacts. So if you're anticipating glasses or contacts, then the FSA would be a good way to put some money aside pre-tax to pay for that. Most of our dental insurance, like New Jersey, the Aetna Dental Expense Plan is the most popular dental plan because it's a PPO. You know that except for cleanings, except for the preventative stuff, we usually have out of pocket for dental, any kind of dental work. The FSA is a great way to pay for that. All right. You know, it takes a little bit of the sting away because you're putting the money aside pre-tax. So the way it works is you enroll for next year. I do so I have a family coverage. I do $1,000. So on January 1st, my Horizon debit card is front loaded with $1,000. And then we take the deduction. We take the deduction over the 26 pays, or for faculty, 22 pays through the rest of the year. And then you just show the card.
Is that when you roll over, or you have to use it within the year?
You have to use that within the year. Great question. So if you've never done it before, be very conservative. Only elect what you know you can spend for that year. They will give you January 1st of 23 through March 15th of 24 to spend the money.
Sorry, but how are those purchases, like, are they reviewed? Like, can you go to CVS and buy?
So it's all built into the card. So if you swipe it, it'll pay for what it's gonna pay for.
And then you are the difference.
Yeah.
Yes.
Okay.
It's actually covers a
They
lot.
and they do it well. Yeah. Yeah. So you'll swipe the Horizon card first and then your debit card for whatever's left.
Okay. And it will decline if it doesn't. Okay. So like if you're going for Band-Aids or whatever, just try and
Try it. Right.
whatever.
And some of those things, some of the over-the-counter things are
Yeah, I don't
covered.
know if that's included. I'm
Like
just saying.
my FSA paid for this wheelchair,
Okay.
so. They were good.
I have two questions. The FSA account this time was different than previous ones in terms of who was running it. This one showed no grace period. Is that the case still? Can you repeat the question, please?
So the question was, so we used to have WageWorks up until 2021, I think, and then it switched to Horizon My Way. There is still a grace period, and I think when I log into my account, it tells me I have from January 1st through March 15th of the following year to do it. They do definitely still have the grace period. During COVID, there was a longer grace period, but we're back to the standard up to March 15th to be able to spend the funds. What else about the FSA? Go ahead.
But you have to do it during October because I failed to do it.
You have to do it this month if you're going to elect. And just a reminder, everybody that has it this year that wants it next year has to go in and do it this
Really
month.
easy, I just did it.
There's so that the second email, the tax save email, has ways to enroll, and they have an online enrollment. I put the link, you just plug in your social security number and your date of birth and you go in and elect. Remember, there's two types of plans. So there's the medical expense account, and then there's the dependent care account. The dependent care account is for people that have kids like in daycare, summer camp, preschool. You're using it for those expenses.
After school.
After school, yeah. If you And there's an FSA guide to really, especially if you're doing the dependent care, really read up on how it works and what it's used for. Don't confuse, the medical expense account is for you and your eligible dependents. So you can actually get a debit card for all of your dependents, but that's the medical expense account. Some people have confused dependent care, meaning, oh, I want my kid to be able to pay for his copays. That's still the medical expense account. Dependent care is strictly for daycare. Actually, there's some elder care expenses too, if you're taking care of older family members. But please, if you're doing the dependent care, please read on the guide, which is in that email, about how it works.
Have the maximums stay the same?
Maximums, so federally, I think the maximums have changed, but the state is sticking with the 2,500. 2,500 is the maximum for medical expense and 5,000 for dependent care. There's no debit card for dependent care. So with a medical expense account, if I choose $1,000, I can use that money right away. The dependent care account, you use it as it accrues, and there's no debit card for that. So again, it's just the way that if you visit specialists regularly now, you're going to feel it because it's an additional $15 every visit. The flexible spending account isn't going to be your cure-all, but it takes a little bit of this thing. And it's nice to not have to use your own bank account or pay cash at the appointment when you can use this money that is taken through payroll.
Is there a minimum for the medical care?
It may be like $100 minimum. I mean, it's kind of, I wouldn't go that low, but do only figure what you're going to spend in a year, for prescriptions. So if you fill certain amounts of prescriptions, factor that all in. I would say though, if you wear glasses, an easy way to spend that money down, if you're got money left, is to just go buy a pair of glasses. Obviously they have to be prescription glasses. And Horizon they have a great phone app. If you have it and use it, they have a great phone app. You can go in, you can pay the provider directly through the FSA funds, or you can you reimburse yourself. Just take a picture of the receipt and upload it. Always has to be itemized receipts especially for dental and vision. They know what our copays are, so when you swipe $15 or $30, they're not going to harass you for receipts. But for dental work and glasses, they want to make sure that, like for glasses, that you're not just buying an expensive pair of Ray-Bans or something, that they're really prescription sunglasses. Anybody have, that's the basics basically of what's happening this year. Is there any questions about anything? Oh, I do want to point out, so here you can, let me find it. This should open, right? If I click on the link.
Bart, I'm not starting rumors, and no, I am not retiring.
Okay.
But is there any, I'm always thinking about what's happening.
I'm always thinking about retiring. So.
No, I am not retired. I'm starting my rumors. Yeah. What's happening with health benefits for retirees?
There's been, I wouldn't expect any changes to, how every time the contracts change,
Right.
new groups of people are grandfathered in.
Right.
I wouldn't expect any kind of change until there will be another contract. So there's not, as far as I know, everything is the same as it has been. They're still moving any Medicare eligible retirees, they're still defaulting them into the Medicare Advantage plan when they turn 65.
That's what I was going to ask. Is Medicare Advantage required as our supplement?
Depending on when you hit your 25 years.
Oh, I'm well beyond 25 years.
Yeah, but depending on when you reached it, depending on what contract that they were in at that point, will determine what plans are offered to you. But they're automatically defaulting, as soon as you hit Medicare, they're automatically defaulting you into the Medicare Advantage plan. Some people will have the option to move out like back into a kind of more of a gap, Medicare gap type plan.
Yeah.
I will say for anyone out there that's pondering retirement, I have heard no major complaints from retirees about the Aetna Medicare Advantage plan. And normal, I mean, if people want to complain, they will call me. Nobody's shy about that, even if they retired 5 years ago. But I've heard no major complaints. According to Aetna, as long as the provider, it's nation, they know, the state knows that a lot of our retirees leave the state after they retire. So it's nationwide coverage. According to Aetna, as long as the provider accepts Medicare, they will treat you in network.
Do you know what year, what contract that pushed people into the Medicare Advantage? It was how long ago?
Everybody is being pushed into the Medicare Advantage. It's just that some people, depending on when they hit 25 years, still may have the option
Do you know
of,
what that year was?
off the top of my head, no. It was, yeah. It was definitely, at the minimum, it was prior, you had to have your 25 years prior to the last contract, which was, what, July of 20? July of 19. July of 19. So you had to definitely have the 25 years prior to that. I'd have to check in that gap right before that. So we can just stop in one day and we'll talk.
2011, 25 years.
2011. So you may still have the option of the New Jersey Direct 1525, which is the old gap plan. I say you may. We'll check. So,
But I'm not retired.
but you're not retired. All right. So I just wanted.
I just got a text. I heard that.
No, my heels are plugged in right now.
So I just want to show you, I mean, I'm sure you've used this before. I just want to show everybody how to use this calculator. So this will determine your per pay deduction for next year. So the employee type so for this purposes of this meeting, you're all in state union negotiated plans. Coverage type, I'll choose family. This doesn't give you an option, so we all have the state health prescription plan. The state does not give you a choice. If you have medical, you have to have prescription. And I'll just use I'll use 70,000 as a salary. And then you choose your date of hire. So you were hired either prior to 7/1/19 or after 7/1/19 or after. So I'll do prior to 7/1/19, hit compare. And this is where you have to get out your phone calculators. All right, so shows you have 5 plans available to you. This is the annual contribution. So if you're a 12-month employee, you're going to divide the annual over 26 pays. If you are a 10-month faculty, you're going to divide it over 22 pays. That's the amount. So this is somebody that makes $70,000 a year with family coverage. The more or less you make will determine things, and how many dependents, single member spouse or family or parent-child will also be a determining factor. So you'll see the Omnia plan is 25%, should be around 25% less than the New Jersey Direct. And this amount, if you're obviously in the plans now, when you calculate this, it should be about 3% higher than what you're currently paying. I did mine, and my contribution is going to go up $10 a pay next year. I say again, it could have been a lot worse. So
3% is the cost of our salary increase.
it's a 3% increase over what it was last year.
The cost.
Yeah. Yeah.
You said that will be variable depending on our income, though.
It's going to be variable depending on your income and depending on how many people you cover. Yeah, so that's why you want to you will put your income in. And just in case, I mean, we talked about this when the last contract was the 7/1/19 date. Just the difference in, so for the people that are in New Jersey Direct, you're either in New Jersey Direct or you're in New Jersey Direct 2019. If you were hired after July 1 of 19, you're in New Jersey Direct 2019. The only difference there is for the people hired after July 1st of 2019, you have a $100 in-network deductible for three things, only three things: for durable medical equipment, oxygen, and ground ambulance. So if you were hired after July 1 of 19 and you have any durable medical equipment, so the example I'll use is a lot of kids have nebulizers for asthma. So if you're hired after July 1 of 19 and your kid has asthma and you have a nebulizer, you would, for that nebulizer, you would pay the first $100. You'd have to meet $100 deductible. And then for the durable medical equipment, you were already covered at 90%. So you have to meet the $100 deductible first, then you have 90% coverage on that machine. So the big ones that come out, like nebulizers, CPAP machines, things like that. Any durable medical equipment. That's the only difference in the New Jersey Direct versus the New Jersey Direct 2019 is that $100 deductible, and it's just for those three things. It's not for everything. Durable medical equipment, oxygen, and ground ambulance.
Per person or per capita? That $100.
I thought it was a per person deductible. I thought. Any question? Is there a chat up? Like if people are asking questions?
I don't see anything in the.
You don't see anything in chat? Okay. So any questions about any of this? Okay, well, again, so you have till the 31st. Ignore the health benefits one if you are happy, but definitely do the FSA by, so the 31st is a Monday. So by close of business on Monday, make sure that you are enrolling in the FSA for next year. Okay. And Kim, Allison, and I are here at, whenever you need us.
We can do the FSA right online.
You can do the FSA right online, yeah. And that's, look for that other email, the tax save flexible spending account, which we sent out October 3rd, right around 9 o'clock in the morning. They both went out. All right, thanks, everybody.
Thanks, Bart.